Hey, I know your pain. I was feeling the same way not long ago. I'm here to help you. In the following minutes, I'll show you how I was able to transform my life. Watch this closely and thank me after that.
CBD oil for chronic pain relief. In this video, we'll go over the benefits, potential, and effects of CBD treatment for chronic pain. While many people use cannabidiol to relieve pain, more scientific research is needed to be sure it is safe. Understanding cannabidiol can help overcome the stigma associated with it. Some people experience side effects when taking cannabidiol, CBD, and there are other factors to consider before using CBD oil for pain. In this video, we look at how CBD oil works and how people can use it to relieve chronic pain. Keep watching to learn more about the potential benefits of CBD use for pain. You can also talk with your doctor to see if it's an option for your condition. Overview: cannabidiol, CBD, is a type of cannabinoid, a chemical found naturally in cannabis, marijuana and hemp plants. CBD doesn't cause the high feeling often associated with cannabis. That feeling is caused by tetrahydrocannabinol, THC, a different type of cannabinoid. Some people with chronic pain use topical CBD products, in particular CBD oil, to manage their symptoms. CBD oil may reduce pain, inflammation, overall discomfort related to a variety of health conditions. The research on CBD products and pain management has been promising. CBD can offer an alternative for people who have chronic pain and rely on medications, such as opioids, that can be habit-forming and cause more side effects. However, more research is needed to verify the pain-relieving benefits of CBD oil and other products. Effects: CBD oil is usually extracted from industrial hemp. CBD is one of more than 120 compounds called cannabinoids. Many plants contain cannabinoids, but people most commonly link them to cannabis. Unlike other cannabinoids, such as tetrahydrocannabinol, THC, CBD does not produce a euphoric, high, or psychoactive effect. This is because CBD does not affect the same receptors as THC. The human body has an endocannabinoid system, ECS, that receives and translates signals from cannabinoids. It produces some cannabinoids of its own, which are called endocannabinoids. The ECS helps to regulate functions such as sleep, immune system responses, and pain. When THC enters the body, it produces a high feeling by affecting the brain's endocannabinoid receptors. This activates the brain's reward system, producing pleasure chemicals such as dopamine. Many people are curious. Does CBD make you high? CBD is an entirely different compound from THC, and its effects are very complex. It is not psychoactive, meaning it does not produce a high or change a person's state of mind, but it influences the body to use its own endocannabinoids more effectively. According to one study posted to Neurotherapeutics, this is because CBD itself does very little to the ECS. Instead, it activates or inhibits other compounds in the endocannabinoid system. For example, CBD stops the body from absorbing anandamide, a compound associated with regulating pain. So, increased levels of anandamide in the bloodstream may reduce the amount of pain a person feels. Cannabidiol may also limit inflammation in the brain and nervous system, which may benefit people experiencing pain, insomnia, and certain immune system responses. Okay, so what exactly is it? What is CBD oil? Different cannabis plants, often called hemp or marijuana, contain different levels of chemical compounds. How people breathe the plant affects the CBD levels. Most CBD oil comes from industrial hemp, which usually has a higher CBD content than marijuana. Makers of CBD oil use different methods to extract the compound. The extract is then added to a carrier oil and called CBD oil. CBD oil comes in many different strengths, and people use it in various ways. It is best to discuss CBD oil with a doctor before using it. Benefits: people have used CBD for thousands of years to treat various types of pain, but the medical community have only recently begun to study it again. Here are some of the possible benefits of CBD oil. CBD for chronic pain relief. Everyone has a cell signaling system known as the endocannabinoid system, ECS. Some researchers think that CBD interacts with a core component of the ECS, endocannabinoid receptors in your brain and immune system. Receptors are tiny proteins attached to your cells. They receive signals, mostly chemical ones, from different stimuli and help your cells respond. This response creates anti-inflammatory and pain-relieving effects that help with pain management. This means that CBD oil and other products may benefit people with chronic pain, such as chronic back pain. One 2018 review assessed how well CBD works to relieve chronic pain. The review looked at studies conducted between 1975 and March 2018. These studies examined various types of pain, including cancer pain, neuropathic pain, fibromyalgia. Based on these studies, researchers concluded that CBD was effective in overall pain management and didn't cause negative side effects. Arthritis pain. CBD oil is popular for easing pain associated with arthritis. A study in the European Journal of Pain used an animal model to see if CBD could help people with arthritis manage their pain. Researchers applied a topical gel containing CBD to rats with arthritis for 4 days. Their researchers note a significant drop in inflammation and signs of pain, without additional side effects. People using CBD oil for arthritis may find relief from their pain, but more human studies need to be done to confirm these findings. Multiple sclerosis. Multiple sclerosis (MS) is an autoimmune disease that affects the entire body through the nerves and brain. Muscle spasms are one of the most common symptoms of MS. These spasms can be so great they cause constant pain in some people. One report found that short-term use of CBD oil could reduce the levels of spasticity a person feels. The results are modest, but many people reported a reduction in symptoms. More studies on humans are needed to verify these results. Chronic pain. The same report studied CBD use for general chronic pain. Researchers compiled the results of multiple systematic reviews covering dozens of trials and studies. Their research concluded that there is substantial evidence that cannabis is an effective treatment for chronic pain in adults. A separate study in the Journal of Experimental Medicine supports these results. This research suggests that using CBD can reduce pain and inflammation. The researchers also found that subjects were not likely to build up a tolerance to the effects of CBD, so they would not need to increase their dose continually. They noted that cannabinoids, such as CBD, could offer helpful new treatments for people with chronic pain. CBD for migraine pain relief. Studies on CBD and migraine are limited. The studies that currently exist also look at CBD when it's paired with THC, not when it's used alone. However, results from a 2017 study indicate that CBD and THC can lead to less acute pain and less intense pain for people with migraine. In this two-phase study, some participants took a combination of two compounds. One compound contained 9% CBD and almost no THC. The other compound contained 19% THC. Doses were taken orally. In Phase 1, there was no effect on pain when the doses were under 100 mg. When the doses were increased to 200 mg, acute pain fell by 55%. In Phase 2, participants who received the combination of CBD and THC compounds saw the frequency of their migraine attacks fall by 40.4%. The daily dose was 200 mg. The combination of compounds was slightly more effective than 25 mg of amitriptyline, a tricyclic antidepressant. Amitriptyline reduced migraine attacks by 40.1% in study participants. Participants with cluster headaches also found pain relief with the combination of CBD and THC compounds, but only if they'd had a childhood history of migraine. CBD for cancer treatment relief. Some people with cancer also use CBD. Research on mice has shown that CBD can lead to the shrinking of cancerous tumors. However, most studies in humans have investigated the role of CBD in managing pain related to cancer and cancer treatment. The National Cancer Institute (NCI) trusted source has pointed to CBD as a possible option for reducing chemotherapy side effects, such as pain, vomiting, lack of appetite. In a 2010 study on cancer-related pain, study subjects received oral sprays of a combination THC-CBD extract. The THC-CBD extract was used in conjunction with opioids. This study revealed that using the extract provided more effective pain relief than using the opioids alone. A 2013 study on THC and THC-CBD oral sprays had a similar finding. Many researchers from the 2010 study worked on this study as well. More evidence is still needed. Other uses. CBD currently has a range of applications and promising possibilities. These include Smoking cessation and drug withdrawal treating seizures and epilepsy anxiety treatment reducing some of the effects of Alzheimer's, as shown by initial research antipsychotic effects on people with schizophrenia future applications in combating acne, type 1 diabetes, and cancer. Although more research is required to confirm some uses of CBD oil, it is shaping up as a potentially promising and versatile treatment. In June 2018, the U.S. Food and Drug Administration (FDA) approved one form of CBD as a treatment for people with two rare and specific kinds of epilepsy, namely Lennox-Gastaut syndrome (LGS) or Dravet syndrome (DS). The brand name of this drug is Epidiolex. More generally, marijuana-derived CBD products are not yet legal at the federal level but are legal under the laws of all 50 states. People must check their state's laws and those of anywhere they intend to travel. They must keep in mind that the FDA do not approve or regulate non-prescription CBD products. As a result, labeling may be inaccurate. CBD side effects. CBD doesn't pose significant risks for users, and most topical CBD products don't enter the bloodstream. However, certain side effects are possible, such as fatigue, diarrhea, changes in appetite, changes in weight. CBD may interact with certain over-the-counter (OTC) drugs, prescription medications, dietary supplements. Proceed with caution if any of your medications or supplements contain a grapefruit warning. Grapefruit and CBD both interfere with enzymes that are crucial to drug metabolism. Like other drugs and supplements, CBD may also increase your risk of liver toxicity. One study on mice concluded that CBD-rich cannabis extract increased their risk of liver toxicity. However, some of the mice had been injected with very large amounts of the CBD-rich cannabis extract. Dosage. The FDA does not regulate CBD for most conditions. As a result, dosages are currently open to interpretation, and people should treat them with caution. Anyone who wishes to use CBD should first speak to a doctor about whether it is a good idea, and how much to take. The FDA recently approved a purified form of CBD for some types of epilepsy, with the brand name Epidiolex. If you are using this medication, be sure to follow the doctor's advice about doses. Other considerations. Almost all research on CBD oil and pain comes from adult trials. Experts do not recommend CBD oil for use in children, as there is little research on the effects of CBD oil on a child's developing brain. However, people may use Epidiolex for children aged 2 years of age and upward who have rare forms of epilepsy. A person should consult a doctor if they think a child needs to use CBD oil for seizures. CBD oil is also not recommended during pregnancy or while breastfeeding. Takeaway. While many studies have suggested CBD oil is helpful for pain, more research is necessary, especially in long-term studies with human subjects. However, CBD oil does show a lot of potential for pain relief. Anecdotal evidence suggests that it can be used to help manage chronic pain in many cases. CBD oil is especially promising due to its lack of intoxicating effects and a possible lower potential for side effects than many other pain medications. People should discuss CBD oil with their doctor if they are considering using it for the first time. Below are some links to trusted CBD products that have been tested by third-party labs.
Thank you for watching our video. I hope the information we presented shows you our excellent service. So, what are you waiting for? Take action now and feel the change soon.